little Billy. Hi, I'm Chris Hansen from Dateline NBC's To Catch a Bone Disease. Why don't you take a seat right here?
I thought this was little Billy's house.
It is. It is. Now, I need you to take a seat.
No, I don't want to.
We need to talk. We need to talk. Thank you.
How do you do that?
Thank you. I'm calling a doctor to talk to you about all the bad things you've been doing to people, alright? I have Marfan Syndrome right here. Oh, you're already here? Okay, well, why don't you just come on in and take a seat, and we'll talk to him. Alright.
Oh, hello.
Hey, Chris. Dr. M, why don't you take a seat right here?
Alright. It's a cold day today, isn't it?
Very cold.
Alright.
Marfan Syndrome.
Well, Chris, it's pretty simple. Marfan Syndrome is a disorder of the connective tissue that strengthens the body's structure. It affects skeletal and cardiovascular system, the eyes, lungs, and the skin.
How did Marfan Syndrome actually come to be?
That's a very good question, Chris. It has a fairly long history, and it started in 1896 when it was named after Antoine Marfan, who first diagnosed it to a patient of his. And in 1914, dislocated lenses was an associated symptom with Marfan Syndrome. In 1943, the aorta complications were reported with people who had Marfan Syndrome. In 1990, chromosome 15 was identified as the general location of the gene. And the next, in 1994, beta blockers were found effective in slowing progression of the aorta enlargement. And then in 1995, life expectancy was 72 years. Now, there's much more that has gone on, but this is just a summary for you guys.
Now, what is the anatomy or origin of this disease?
Well, this is where it gets a little complicated. When we get down to the anatomical level, we find that Marfan Syndrome is caused by a defect or a mutation in the gene which tells the body how to make the protein fibrillin. That is important in connective tissue. This defect causes an increase in the protein TGF, or transforming growth factor beta. Now this creates problems in tissue throughout the entire body, causing Marfan Syndrome features and symptoms. And it is inherited from the parents.
What are some of the symptoms of Marfan Syndrome?
Well, there are plenty of symptoms, but there was one symptom that sunk into everybody's minds and stuck out to everybody. And this symptom is that the chest will either sink in or it'll stick out. And when it sinks in, it's called funnel chest, or pectus excavatum. And when it sticks out, it's called pigeon breast, or pectus carinatum. Now, other symptoms that are related with it are flat feet, highly arched palate and crowded teeth, hypotonia, which is decreased muscle tone, highly flexible joints, like unnormally flexible joints. Learning disabilities have also been linked with Marfan Syndrome. Movement of the lens of the eye from its normal position, nearsightedness, a small lower jaw. The last two symptoms are scoliosis and thin, narrow face. Now, if you have any of these symptoms, you should go see your doctor immediately. And that brings us to our next point, treatment. First off, the thing that you should know with Marfan Syndrome is that there is no cure. But there are many things that can be done that can lessen the effects and lengthen your lifespan with living with Marfan Syndrome. First off, if you have any vision problems related to Marfan Syndrome, they should be treated when possible. You should monitor for scoliosis, which is a very bad thing to have. Now, medicine can be used to control the heart and may help prevent stress on the aorta if the chest is caving in. Now, you should get regular checkups for skeletal and cardiovascular systems to see if there's anything wrong. Medication if there is swelling of the spinal cord should be taken. Seek medical attention if it is hard to breathe or you have chest pain or pressure. Now, and lastly, surgery may be needed if there's any damage to your aorta.
Are there any things people shouldn't do if they have this disease?
Yes, there are a few things that people shouldn't do with living with Marfan syndrome. First off, you shouldn't smoke. It'll increase the risk of lung damage. And you shouldn't compete in contact sports because it can cause a ruptured aorta or swelling of the aorta.
Are there any alternative therapies?
Well, one should take place in mild exercise, like no contact sports, but like mild exercises, like
running.
Yeah, like running.
Are there any notable people who've been diagnosed with this disease before?
Well, there are a few famous people. Bradford Cox, who's the singer of the band Deer Hunter, Josh Taverner, who was a bridge composer, have both been diagnosed with this. Now, there are also a few people who have died from Marfan syndrome, and they all died from an aorta rupture or an aneurysm. Flo Hyman, who was on the 1984 U.S. volleyball team, Jonathan Larson, who wrote the musical Rent, Ronalda Pierce, who was a college basketball player, and Ewell Gibbons, who was a food advocate. And they've all died from this disease.
Thanks for your time, Dr. M.
Thanks for having me.
Have a nice day.
Alright, you too.
How do you feel about what you do to people?
I do what I do. You can't stop me.